This nice lady was referred to me because she has a history of Meniere's disease. And this has been going on for 4 years, and it's in the right ear. Is that correct?
That is correct.
And you have a lot of hearing loss in that ear?
I do.
And you were really having a lot of tinnitus that was not just there, but it was changing a lot. And every day, was it changing in its loudness or in its character?
It would be louder and it would be more bothersome, and the hearing would decrease.
Okay, so you're having tinnitus that was changing, fluctuations in your hearing levels. Was your ear feeling full?
It did feel full all the time.
And were you having you were having episodes of vertigo?
I was having frequent episodes of vertigo.
Okay. And those were, I think, less frequent in the first year, a few times a season, but got more frequent.
That's correct. I had vertigo just several times over the winter for the first couple of years, but starting a year ago, the episodes of vertigo increased to, 4, 5, 6, 7 times a week, depending on, the week. But it was very, very frequent.
Right. So you were treated at first just with episodic medication that you could take when you got dizzy.
That's correct.
But then in the last year, you were treated with steroid injections?
That's right. I had 3 steroid injections, but the longest that I was able to get any sort of relief from the vertigo was about 2 months.
Now, you were sent to me because you mentioned at your last appointment after the 3rd steroid injection that you have a lot of headaches.
That's correct. And I have worse headaches after each episode of vertigo.
And you've had headaches for years, though.
I've had headaches since I was little. They're just something that I've always had.
I see. But you never mentioned them because for you, they're normal.
They're normal, exactly.
The dizziness was not normal, and you went to the ENT doctor for that.
That's correct.
So when I met you, we realized that you have chronic migraine. And we decided, because of the connection between migraine and Meniere's disease, to treat your chronic migraine. And I gave you a calcium channel blocking medication, which is a preventive medication. It's a blood pressure medicine. Do you have any negative effects of the medication?
I've had no side effects at all.
And when you, have you had any big response in your symptoms?
Actually, I had 1 episode of vertigo the day after I started the Cardiazem, but since that time I've had no more dizziness, no vertigo, and the tinnitus has been very manageable and low level and more chronic and consistent and without the big fluctuations.
Wow, that's a big change.
It is. I feel so much better.
So you went from having dizziness, episodes of vertigo every day or every other day to having none now for 8 weeks.
That's correct.
That's pretty remarkable.
Oh, it's amazing.
Now you have ear fullness too?
I don't have much ear fullness. It's just more the ringing that I'm still left with.
So the ear fullness has gone
decreased
away,
a lot,
diminished
yes.
a lot. Do you still have headache?
I still have some headaches, but they're the same headaches I've had for most of my life. They're low level, and I can treat them with Tylenol.
I see. So you're still having frequent headaches, but are they in the same place as your worse headaches?
Yes, they are.
Okay, so it's the same headache, it's just not fully expressed.
That's correct.
Yeah, so what we're going to do, because you're not having any negative effects from the medication, is increase the dose a little bit. And maybe we'll get rid of the headaches as well and prevent your ear from continuing to be injured by the headache activity. And this way we may be preserving the residual hearing.
That would be awesome.
Well, I appreciate your sharing this story. I am sure that there are many other individuals who have Meniere's disease, but who also have a history of migraine, but whose migraine has never been treated as a way of controlling their vertigo episodes and their Meniere's disease. And I hope that they'll find this and benefit from your story.
I hope so too.
Thank you.
Thank you.